Good afternoon, good morning, everyone. Hope everyone's doing well. Welcome to the Permobil Academy webinar series. My name is Brenly Mogul-Rotman. I will be your moderator for today's session. Also in the background, I've got Heather Sanciello, who will also be co-moderating with me. And today our webinar is titled Vicair, the O2 Cushion Technology and Clinical Applications. I would like to introduce our presenter for today, Anna Enjo, and I'm going to pass it over to you, Anna, to introduce yourself and start your presentation.
Very well. Thank you, and hello, everyone. As Brenly mentioned, my name is Anna Enjo, and I am an occupational therapist by trade. I have worked in multiple settings, but mostly with the geriatric population. So a lot of my time has been spent at nursing home settings, subacute, as well in hospitals, lymphedema certified therapist. Also worked at PACE programs throughout the United States, which is another geriatric setting. It's kind of known as the nursing home without walls. And within that time, I've really spent most of my time dedicated to contracture management, wound management, and as well as seating and positioning. And I have used the Vicair technology for many years, which is hence why I'm giving you this course today. So I am also the National Education Manager for Permobil for our long-term care division, and I'm excited to be with you guys today. So we are going to actually do another poll right now. So Brenly, if you wouldn't mind posting that poll.
Yep, Heather, you're up.
Yes, hi everyone. Okay, let's see if we can get to poll 2. And here we have you ever heard of non-flowing air technology? And if you can answer yes or no, that would be great. And we'll give it a few minutes. And it's looking like the yeses are pulling ahead. It is at, let's see, they're still ahead. I see, looks like everyone's done, and it's 54% yes and 47% no.
Excellent. All right, thank you for running that poll. That really helps me because those of 47% of you that answered no are going to get a lot of information on exactly what that means. All right, so I'm going to turn off my camera now just so it's going to be easier for you to focus on the webinar itself. Let me just do that. All right, so as she mentioned, we're going to be talking about non-flowing air today. And we all know that air is a proven medium to use with clients that are at high risk for pressure injury development, or actually with clients with a current pressure injury. And why? Why is air this proven technology? And it's really because it mimics viscous fluid and continuously adjusts and then readjusts to any shape. And the immersion and the envelopment that it allows for really redistributes pressure evenly around your client as you sit on it, okay? Protecting their bony prominence, or if you're the user yourself, it's going to protect your bony prominence and really the skin and the soft tissue underneath of that bony prominence from excessive stress and strain. So we often think of air technology in seating as flowing air or fluid air. And this is when the air actually moves in and between the cells. So if you look at this picture on the left, you see our ROHO cushion and you see all those finger-like projections, which are our air cells. And as someone sits on it, the air actually moves from one cell to another cell to adjust and readjust with that person's movement, okay? So that's what we're used to seeing. That's been on the market for what, like 60 years, I think? And so that's what we're more accustomed to using and seeing. But Vicair is very different. Vicair technology, on the other hand, is air technology that uses non-flowing or static air. And I'm sure right now, for those 47% of you that said, I've never heard of this, you're like, well, what exactly does that mean? And so what that means is if you actually look on the screen, that the air stays within each cell. So each one of these kind of like little sour cream packet looking things on the screen is the air cell. And the air does not move from one of these cells to another. The air is contained within its cell itself, and it's actually the air cell itself that will shift around within a given compartment, immersing and enveloping the object that's sitting on it, okay? So now what I'm gonna do for you is I'm gonna actually play a video because the videos do a great job of explaining how these two technologies work. They're both fantastic. They both are different kinds of solutions, and one may work better for one and one may work better for the other. But the great news is that there's two technologies that are proven to work, that are great solutions, and we can actually just offer more solutions across the board because we have both of these technologies within our portfolio. So I'm going to play a video right now. So there will be a small lag as I start to play them. So please don't think anything's wrong. So go ahead and start the first video for you.
At Permobil, we engineer our RoHo cushions using dry flotation technology. This allows our customers to be in their wheelchairs, experiencing life for more hours each day. While cushions might look the same, there are 4 fundamental design principles that set a RoHo cushion apart from the rest. A RoHo cushion lets you in. Our unique cushion design is based on the principle of low surface tension, allowing you to easily sink into the cushion. This results in reduced pressure and discomfort to your skin and soft tissue. A RoHo cushion matches your shape. We know your shape is unique. The RoHo cushion constantly conforms and adapts to you and can be adjusted to your body changes over time. A RoHo cushion moves with you. No matter what you're doing, your RoHo cushion will adapt to your every position throughout the day and over time. The air cells follow your motions, giving you support and freedom of movement. A RoHo cushion works with you, not against you. The smooth surface reduces shear and friction without compromising your safety and comfort. These 4 fundamentals provide the comfort and protection you need to let you make the most of everyday life. Nothing.
Okay, so now I'm going to play the next video for you, looking closer at the Vicair technology.
The unique Vicair Air technology, which uses the small air-filled smart cells, was developed in cooperation with the Amsterdam Rehabilitation Center. It was awarded the Grand Prix at the Salon des Inventions in Geneva, Switzerland. Vicair develops and produces its product line in the Netherlands for customers all over the world. When you sit on a Vicair wheelchair cushion, you are supported by hundreds of smart cells. The layers of cells inside the cushion compartments move with so little friction that the effect resembles the behavior of a viscous fluid, slowly adjusting to the shape of your body. Also, because smart cells deform individually, they conform to your body's contours. The result is superior pressure redistribution. Moreover, the design of the cushion compartments make the Vicair cushion ultra-stable and prevent the person sitting on it from sliding forward. This reduces shear forces to a bare minimum, helping to maintain optimal posture, functional positioning, and high-performance skin protection. Vicair Smart Cell cushions are extremely user-friendly. The well-balanced filling rate ensures that Vicair cushions are ready to use. Vicair, relief by air.
All right, so now I'm going to go back to our PowerPoint. Give me one moment there. All right, so I should be back. All right, so moving on. Sorry, gotta click through this 1 second. All right, so Vicair cushions, as that video said, use smart cells, which are tetrahedron shaped. And you can see that really well up here in this top left-hand quarter. And that's not quite a triangle or a pyramid, but it's truly a combination of those two. And the shape of smart cell is actually very key. And when they're slightly compressed, like you can see in this lower picture, they actually allow for the smart cells to kind of settle into layers under the weight of an individual. And because of their shape, they interlock with each other. And again, if you kind of just focus on this little cluster up here in this picture, you can start to see how, because of its shape, they can kind of lock into each other. And they're never going to kind of, form a gap or a hole where someone can fall through or bottom out. So it really does provide a nice stable surface for the end user. How do the smart cells move and protect the skin and soft tissue under the bony prominences? And I'm going to start to play this video as I'm talking so you can really see it well. So these smart cells are constructed of that soft material that have a thin outer wall that allows them to, as you saw in that other picture, really compress under any pressure and easily can slide against each other within their given compartment, to then settle around the user, conforming to their shape, and by immersing and enveloping the client, they're protecting them from during any micro movement that they might be taking. Okay, let's start the second video for you guys. And by immersing and enveloping the anatomical shape of the user, contour is created, and we can increase contact area being made between the user and the cushion. And we know that when it comes to pressure injury management, by increasing the surface area between the user and the support surface, such as this cushion, then we create a more optimal pressure redistribution. And then thanks to that tetrahedron shape I talked about, the smart cells will then, like I said, interlock, so that once the individual is seated and settled on the cushion, the smart cells lock together, really providing a nice stable surface that does minimize unwanted movement. So now what we're going to do is take a look at the different Vicair cushions that we have in our Permobil portfolio. And we have 3 Vicair cushions in our portfolio. We have the Vicair O2 cushion, that is shaped and designed to perform more of an offloading features of the bony prominences due to its contour. You can see that in this cushion right up here. It has lots more hills and valleys built into it. It's offering more of a contoured surface for positioning purposes. And it does have this deeper pelvic well, so again, we can partially offload the very, very high risk areas of the sacrum, the ischial tuberosities, and the coccyx, okay? But the great thing about it is that it's filled with those smart cells we've been talking about, which again is an air medium that is going to then allow for immersion and envelopment as well. We also have our Vicair O2 cushion, which is more of a linear cushion, providing for excellent immersion and envelopment. It also does have compartments, but they're larger, and so it's not as much of a positioning cushion, and we'll talk more in detail about that in a second. And then our last cushion in our Permobil portfolio is our Active O2. And this is a hybrid foam and air cushion providing positioning and stability, especially for an active user. So here you can see there's a foam inlay in the front, and then we have the 4 compartments filled with those smart cells in the rear. And within each of these Vicair cushions, there are a predetermined number of smart cells within each compartment. And it really does create a ready-to-use seating surface straight out of the box. So you can take it, like I said, straight out of the box and use it as is. However, I think most of us know that we all have very individualized needs, and that's what the beauty of this cushion is. And so we are able to simply add or subtract smart cells from any of those compartments to really then accommodate or correct some type of postural symmetry that someone may present with, or maybe you just have a hypersensitivity and you just need a little bit less upward pressure coming back from your cushion, and you're able to remove smart cells and even create a softer surface than what it is straight out of the box. So next thing I'm going to talk about is there are some times that we need to actually take it back to that straight out of the box state, right? And like I said, what makes Vicair unique is its ability to be easily adjusted to a client's individualized need. So each of those compartments, as I said, can be adjusted to fit everybody's individual needs by simply taking out air cells or adding air cells to, again, accommodate your correct postural symmetries. And we suggest that you purchase actually an extra bag of smart cells, and it's very inexpensive, and I think if it hasn't changed, there's usually a bag of 50, very, very inexpensive, so that you can just have some extra smart cells on hand so that you can add in without having to subtract from another compartment. Or the other beauty about this cushion is that these cushions, very rarely do those smart cells go flat, okay? So it's very low maintenance product. But if one of those smart cells were to go flat, number one, if it's just 1 or 2 of the smart cells, no big deal. Just Vicair is really known, and it's powerful because of the number of the smart cells. So if 1 or 2 smart cells were to go flat, it's not going to compromise the integrity of the cushion, okay? But if 1 or 2 of those smart cells were to go flat, you would literally just unzipper the cushion, remove them, chuck them, and then you can actually put a couple smart cells in place. So if you have that extra bag of smart cells, you can actually, quote unquote, fix this cushion. And again, making it a very smart investment, because you never actually have to replace the cushion. You can just replace some of the smart cells if they become damaged. So really, really a great long run financial investment there. So let's say that there's a couple situations where I bought a cushion and I've changed it from its out of the box state, and I need to take it back to its original state. And what might some of those scenarios be? And so, as I mentioned, I really do work mostly with the geriatric population in long-term care settings. And those type of settings, as we well know, have multiple caregivers, right? And also they have really tight budgets. So what's great about these cushions is that when I set it for someone, I have a lot of people taking care of the cushion. I have a lot of people taking care of the patients themselves, and you don't have to be checking this on a constant basis. So that's a big plus. But let's say, because I know in the long-term care setting especially, we need to use things over and over. So if one patient were to leave the facility or expire, then I might need to reuse that cushion with someone else. Another great thing about the Vicair line is, especially for the Vicair Adjuster O2 and the Vector O2, is that these cushions are completely machine washable. So you can completely wash and disinfect them in a machine wash, and then be able to use that with multi-clients. Or let's say that you're a client that has developed C. diff, okay, just a disease that is an illness that is extremely contagious, and you need to be constantly washing your clothing and washing everything. You can actually wash your cushion. So really little off tangent, but a great thing about these cushions. But let's say that I'm in a facility and I've used this cushion with Mrs. Smith, and for some reason she's either left our facility or maybe she has passed away, and I want to take that cushion, wash it, and reuse it with another patient. But I had set this cushion up for obliquity, because Mrs. Smith had a very severe obliquity. And let's say that I had adjusted the cushion and taken 7 air cells out of this side and added 5 air cells to this side, whatever it is that I've done to this cushion. Well, when I go to give it to someone else, they don't have that same obliquity. They might not even have an obliquity at all. So I do need to take that cushion back to its out-of-the-box state and then start from scratch again. And so then look at, let's say I give it to Mr. Jackson. Well, what is Mr. Jackson's individualized need? What do I need to do to this cushion now to meet its need? So I need to take that cushion back to its original state and start over. And so what we have for you guys, and you can actually get this from your supplier, we have it available to email to you, is we have these kind of compartment layout forms. And we have it for the Adjuster O2, we have it for the Vector O2, and we have it for the Active O2. And what it does is it shows the cushion on the form, and on the back of each cushion there's a tag, and each tag shows exactly how many air cells are on that specific cushion. Because obviously a 20 by 20 is going to have more air cells in the compartments because they're bigger than a 16 by 16. So the rear tag of each cushion is going to have the predetermined amount of smart cells that are within each of those compartments for that specific cushion and also for that specific size. So what I do is I take this form, and in these little kind of gray boxes, I write the out of the state number of air cells. So if, let's say, they said there was 89 in each of these, I write 89 in both of these boxes. They told me there were 64 here, and they told me there was 50 here. So I would have 89, 89, 64, and 50 and 50. So I know what the out of the state box, out of the box state was. Then what I do is I put a +7 or a -7 into the box so that I know that I added 7 or I subtracted 7, and I keep that in their file. I print it out, I scan it in, make it part of their electronic file. If you're an electronic, if you still have paper charts, put in the paper chart. And I, as a therapist in a facility that, I worked in a nursing home, like I said, I always kept a running track of all of the sitting and positioning patients that I had picked up, so that if I needed to go back and refer to what did I do for that patient, I was able to do that. Because as you well know, as in hospitals and in nursing homes and different places like that, things seem to grow legs and feet, and they seem to disappear. They walk off and we don't know where the cushion went. So that's another reason why it's important for me to keep track of what I did. Let's say Mrs. Smith's cushion disappeared, and they come back to me and they say, okay, what did she have? And we need to set it up exactly the way that it was. So now I have some type of reference of exactly what I did and I can go buy another adjuster O2, same size, and I can take and adjust the cells to be exactly what she had before. Another reason that you might have to do something like this is, let's say you have within the same patient, you're the user yourself, and you have some type of medical issue come up, and you've had a stroke, and all of a sudden now you have an obliquity that you never had before, or you got really sick with COVID, God forbid, and you've really gotten weak, and your body looks very different than it did when you were your healthy self a couple months ago. And you might have to, either permanently or for a short time change your cushion to accommodate for what's going on in your body now, or your patient's body now. So again, this is just a great form to keep on hand so that you can take it back to, again, its original state and play with it and adjust it according to what your patient needs at that point. Okay, so this is just a little trick of the trade, helps us out. All right, so now what I'm going to do is I'm going to look at the 3 cushions in our portfolio in terms of their shape and what does that do for us. So as I mentioned, we have the adjuster O2, and that is more of our linear cushion. And I've placed that blue line across the top of the cushion so that you can really see that that just means it's more of a flat surface. The compartments are bigger, so it really allows for great immersion and envelopment into this cushion. This is probably my #1 choice in my nursing home settings, because in the nursing home setting and with elderly clients, and actually with a lot of clients, we see a lot of obliquities and we see a lot of posterior pelvic tilt. So for those on the call that don't know exactly what an obliquity is, that is when you actually kind of tilt over in your chair, you're leaning because one side of your pelvis is higher than your other. And we also see a lot of posterior pelvic tilt, which is when you your pelvis slides forward and you start to sit on your sacrum. So it's also known as sacral sitting. So this cushion is a great cushion to deal with those two, because it has these huge compartments in the back that can deal with an obliquity. You can add or subtract air cells, and then also it has this medial anti-thrust component that you can build up to really stop, minimize the forward migration of the ischial tuberosities of someone that would be going into posterior pelvic tilt. So you can really minimize that as well. The other 2 cushions are Vector O2 and our Active O2. You can kind of see have more of a shape to them. And these are what I like to call hills and valleys. They have contour to them. They have these hills and valleys built in that really help for more of a positioning need. They help with alignment, they help with stabilization, and really add beyond just the excellent skin protection of these cushions because of the air medium. It also gives a great positioning component. And so I'm going to kind of go into that a little bit more detail for you right now. So here on the screen, I'm really showing you our Vector O2 cushion. And one of the best things about both the Vector O2 and the Active O2 is that we do have a deeper pelvic well to these 2 cushions. And you can see that really well here. And so that's exactly what this is doing. It's going to partially suspend 3 very high-risk areas for skin breakdown, which are our sacrum, our coccyx, and our ischial tuberosities. So within that area, it is deeper, and it's going to partially suspend those areas so that you don't have as much upward counter pressure coming back up from the cushion, okay? Because it's lower and it's partially suspending. The other contour that's really important to create this deeper pelvic well is what we call this this lateral tapered adductor or a tapered thigh support. So it's thinner in the front and it gets thicker towards the back. You can see that this area is much thicker. And it's also higher than the pelvic well. And that's on purpose so that we can create these shelves for our greater trochanters to sit, and our greater trochanters can withstand much more pressure than our sacrum, our coccyx, and our ITs. So it's purposely taking pressure from this area and redirecting it onto our greater trochanters. Again, if you were to have a greater trochanter wound, maybe not the best option of cushion, but if you're more dealing with someone who has sensitivity or high risk at the sacrum, the coccyx, and the ITs, this is a great option. As well, these shelves really allow the head of the femur to be forced into its acetabulum. You can see that here on our pelvis, to increase stabilization of the pelvis. So it's really going to help us to allow someone to stabilize their pelvis that will then in turn stabilize their trunk so that they can start to reach out and function. As well, it's going to really minimize unwanted movement of the pelvis and to go further into some type of pelvic asymmetry. All right, another key component, I just talked to you guys about this contour, But another really important contour in the Vector O2 and a very mild one in the active O2 is this medial thigh support or abductor. And when I was just starting out, this was called a pummel, right? And so what is the purpose of this pummel? And I know back in the day, you know, and in long-term care, a lot of people use these for the very wrong reason. They would kind of build them up really tall and they would make it really deep to try to stop someone from sliding forward in their chair. And that is not the reason for it at all. This is actually a boundary or a border that's really meant to create, stop your legs from coming together. You can see it keeps your legs apart so that you're not having your knees and your thighs rub together and really pull your pelvis out of position. So it is more of a positioning component to help keep your thighs apart and help with lower extremity alignment. And this piece, plus the tapered adductors on the side, really create these leg troughs that I'm showing you on the screen. And those leg troughs, again, are deeper inset, so they're deeper than the lateral adductors on the side, which are higher, so that someone actually sits in their cushion, not on top of their cushion. So it really helps to provide these leg troughs and a place and a designation for the lower extremities so the femurs are nice in alignment and you're not pulling the pelvis out of alignment. So if the lower extremity is in great alignment, your pelvis is going to be in better alignment, okay? The other thing that I want to point out is because they're deeper and because these contours are higher, you can see that, it actually creates more contact area being made with the femurs, with the thighs, and the seat support. And that is key because we know when we're trying to decrease the risk of a pressure injury, we want to envelop something. We want to surround the tissue as much as we can. And here we're making contact not only with the under part of your thigh, like as if we were just sitting on top of something, but we're now actually wrapping around the thigh. So we're creating more pressure redistribution throughout the entire thigh because we're making more contact. So this is another great part of these cushions, and some people don't even think about it, but we're increasing surface contact area through the contours of the cushion. All right, so that works perfectly into the next topic that I wanted to discuss, which is pressure redistribution. And the NPIAP, which for all of you that don't know what that stands for, that's the National Pressure Injury Advisory Panel. And that group of individuals is made up of top surgeons, physicians, nurses, seating, I'm proud to say seating clinicians as well, researchers, people on ISO committee that are all gurus in wounds, okay? And they come together and they look at all the top research out there and they've come up with best practice for us. And they put that out every year, every couple years, and the most recent version was out in 2019. And they create what is known as the Clinical Practice Guideline. And again, it really is good practice for clinicians and for end users to know what they should be looking for in their products to help minimize the risk of development of a pressure injury or also to help heal existing ones. And they say that in order for a product to be a skin protection product, we have to create better pressure redistribution, kind of like what I just showed you in the slide before. And we do that through three methods of pressure redistribution: immersion, envelopment, and offloading. And what's great is that the Vicair line does it all, okay? Some do it a little bit, one model might do a little more immersion envelopment, while the other one might do offloading more, and the other one does all three, okay? So immersion is really when someone just kind of sits in a cushion and sinks down into it. And then the envelopment aspect is what you really want, is that once someone sinks into the cushion, the medium of the cushion, so in our case air, really wraps around that person's kind of nooks and crannies and mimics your shape so that you're making greater contact with all the surface areas that you possibly can. Again, exactly what I just showed you with what those tapered adductors and that medial thigh support were doing was wrapping around somebody, okay? And then you can also offload, which is taking pressure off of a small surface area, so maybe right under the coccyx, and kind of redirecting it and loading that pressure onto a greater surface area, so more contact between the thighs, etc., or an area that can withstand and tolerate more pressure. So again, if you think about that Vicair O2, that's what I talked about. It partially offloads those high risk areas and then moves the pressure onto the greater trochanters and down the thighs. So here is just a kind of an overall slide that I wanted you all to have. It's kind of doing a side-by-side comparison of our 3 Vicair cushions. But what I really want to focus on, it gives you the Medicare code, etc. But what I really want to focus on is here at the bottom and just talk about some of the really great benefits of all 3. And the first benefit, obviously, is that low maintenance portion. As I mentioned, this is not something that needs to be checked on a daily, nor weekly, nor really monthly basis. You kind of just keep your eye on it. And if you start to see that it looks a little flatter, or you feel that it doesn't feel quite as firm as you had before, then open it up, check out the air cells. And if the air cells are flat, you simply just, chuck the flat ones and replace them with the new one. And so this is great for settings like hospitals or nursing homes or places where there's multiple caregivers. They don't have to be looking at this on a daily basis. It really decreases the burden of care, and it's super easy to train. The therapist sets it up, and then voila, you've got your cushion. Also, because of the shape of those smart cells, as I mentioned, that tetrahedron shape, they interlock, right? And they're not really going to allow for any type of hole or gap to be formed. And because they interlock and they shift and move with somebody, then they really do create a very stable surface. So it really allows an active user to kind of really reach out and be more functional, because they're not kind of like sinking in and falling over. They're still stable. As well, I'm going to skip to the lightweight. All of them are very lightweight. And that's fantastic because they're not going to add a lot of weight to a seating system, to your wheelchair. So if you're someone who's a self-propeller and you're at risk for repetitive strain injuries in your shoulders or your elbows, etc., it really isn't going to add a lot of weight to the system, and it's going to reduce the risk of repetitive strain injuries. The other thing is adjustability. That is key. A lot of air products out there don't have the same type of adjustability. We can actually take, add or remove cells from any compartment and change this cushion completely to then again make it individualized for that specific user. So another fantastic aspect of this cushion. And then my favorite, which is why I kind of skipped over it, and I think this is really important to know, especially after coming out of COVID, and infection control is just all we talk about right now, right? And this is an important thing. And so both the Vector O2 and the Adjuster O2 are completely machine washable. Air cells and everything. So all the smart cells, you don't have to take anything out. Literally what I do is I just take a little rubber band and I tie the 2 zippers together so that it doesn't come open during the wash and air cells just don't fall out. And then you can put this entire thing into a machine wash. Industrial strength machine wash is fine. Wash it, and it's completely clean and disinfected. So fantastic. The Active O2 is a little different because it has this foam inlay. You have to take out the foam inlay from the cover, and the foam inlay itself is actually wrapped with an incontinence liner. So you can take the incontinence, and that's going to protect the foam itself. And in order to clean that, you can actually take the incontinence liner off and put the incontinence liner in the wash, or you can actually clean the incontinence liner on the outside with a bleach water concoction or with some type of industrial strength wipe. But the rest of the cushion, so all 4 of these compartments plus the cover, can all go into the machine wash just like these 2. So again, the only thing you would have to take out for the Vicair Active O2 would be the foam inlay in the front. All right, so now what I'm going to do for you guys is really go through each of the cushions individually and talk about them and their applications, so you can kind of get, okay, well, what might this one be who might it really be good for? So the Vector O2 is that cushion that I showed with the contour, and it is coded as an adjustable skin protection and positioning cushion. And I'm going to go through its contours and kind of just discuss them a little bit more for you. So as you can see really well in this picture, we've got those nice leg troughs, right? They're deeper inset. That's where we're going to kind of guide the femurs and the lower extremities to give them an alignment and a place to sit. And they're going to sit into the cushion. And again, you can see where they'll be wrapped around by the higher pieces on the side. The part D is that lower pelvic well, where again, the sacrum, ITs, and coccyx will reside. You can take air cells out of these compartments to have even more suspension of those areas. I will say be careful. You don't want to probably take too many from this area. This is the one area I will tell you to use caution and take maybe 3 to 4 air cells out at a time. Don't take 5 to 10. take a smaller amount so that you don't take too many away. All right. But again, this is where you're going to get that partial offloading. This section A here are the rear lateral chambers that have that tapered part, so they're wider in the rear. You can see that very well in this picture, that are going to form those shelves that I talked about. This is where the greater trocaners are going to sit. This is where the head of the femur is going to be really pushed into its joint, into its acetabulum, to stabilize the pelvis, okay? And this is where the brunt of the pressure is going to go on this cushion. It's going to go onto the greater trochanter and down the femurs. This front portion is the lateral chamber and the more narrow portion in the front. And this really acts as a boundary or border, again, for lower extremity and pelvic alignment. So this is really stopping the legs from opening up too wide and going into abduction and kind of falling off the sides of the cushion. And they are raised and higher so that the legs can lie in. It has its leg troughs, and then this higher border is going to really minimize that, falling off the sides of the cushion. And then here you can really see quite well that medial piece, the medial thigh support, that again is going to stop the legs from coming together and rubbing. It's going to help with lower extremity alignments, and C and B together are going to be making, again, the beautiful leg troughs that I talked about. All right, the Vicair Adjuster O2 is that cushion that I said the chambers are bigger. There's not as many chambers, there's only 5. It makes for a great immersion and envelopment. Actually, let me go back 1 second. So the Vicair O2 is, as I said, you're really getting kind of the best of all 3 worlds when it comes to pressure redistribution from the NPIP. You're going to get the offloading, and then you're also, because it is made of the smart cells, you're getting immersion envelopment. So anything that's still making contact with the cushion is going to be immersed and enveloped by those air cells. The other thing I wanted to point out is you can see that the inside cover is perforated and very breathable. That's very important for microclimate. And that's the same way as the Adjuster O2 cushion. Okay, so now going back to the Adjuster O2, again, smaller amount of compartments, bigger compartments, better for straight up immersion and envelopment. Great immersion envelopment cushion. You can, as I said, still add air cells into any of these compartments or take them away to accommodate or correct for certain postural symmetries. And with this cushion, I really use it a lot for an obliquity. So if your pelvis is higher on one side or the other, or posterior pelvic tilt where someone's really, kind of their ITs are sliding forward and they're starting to sit on their sacrum. And so this A portion is really great, and you can remove air cells from the front to lower seat to floor height. So if someone is a self-propeller and they just really need to get closer to the ground to get a good heel strike so that they're not like compromising their pelvis by having to slide forward to reach the ground, you can take air cells from the front and lower that seat to floor height so someone can be more successful without compromising their pelvis for self-propulsion. Another thing that's great about these two, if you have some type of leg length discrepancy, you can be playing with those air cells to accommodate for that. If someone's on the shorter side, this part is really digging into the back of their knee, you can take some air cells out of there and kind of accommodate for that kind of thing. This compartment B is the anti-thrust component, and that anti-thrust component can be built up to really, again, provide a boundary or border for that, minimizing that forward migration of the ischial tuberosities. And then obviously the C compartments are really great for playing with an obliquity. If I have a lower side that's really digging into the cushion compared to the opposite IT, I can add air cells into one of these compartments and raise the pelvis back to equal, and then have equal pressure being going through both ITs. So it's really a great cushion to be able to adjust in terms of obliquity and posterior pelvic tilt. The Active O2 is really meant, hence its name, for an active user. It has this foam inlay, and you can see it kind of has the same shape as the Vicair O2, but just much more mild. And it's more mild so that someone can easily get on and off of this cushion. It does have, you can see, very much more mild leg troughs. It does have a more mild medial thigh support. It does still have the lateral borders on the side to prevent you from going off on the sides. But again, it's all just more mild. This firm foam inlay in the front makes for great transfers for a very active user that's constantly, getting out of their chair, going to the bathroom, getting into bed, etc. Just allows for a better transfer, easy to use with the slide board, etc. You can see it still has the same shape. It has a deeper pelvic well. It has the higher raised shelves in the back, the tapered portion, again, for the greater trochanter to sit, lock the head of the femur in the acetabulum, partially suspend these areas for minimizing the risk of breakdown in the IT sacrum and the coccyx. But again, it's just not as aggressive, so that someone can be not locked in their cushion quite as much. They can be a little bit more active of the user. One thing I did want to mention with this cushion as well is here you can see all the pieces taken out of the cover. This is the cover. It's perforated, it's breathable, it's great. The foam inlay has that incontinence liner, so it's protecting the foam, and you can take the liner off to wash it, or you can again wash it with an industrial strength wipe. And these 4 back pieces have that same perforated liner like these do. Surrounding them, they can be placed back into the cover, and the whole thing can be washed together. So these 5 pieces can be machine washed. This one, the cover, can be washed, but not the foam. All right, so some common questions that I get with this, and this is important. So, the first question is, how do I adjust these cushions? Like, what's the best practice? And when it comes to taking air cells in and out, if it's a bigger, fatter compartment, take 5 to 10 air cells at a time. So those lateral thigh supports or the big tube compartments in the back from the adjuster O2, feel free to take 5 to 10, air cells out at a time. And start to play with it there. You can add some back in if it was too much, or you can take more out. So that is how we usually start to adjust those. We just unzipper it and start making sure, again, to use that form and saying exactly which compartment you were playing with the air cells. Now, if you're doing it from a thinner compartment, so like in the VicairO2, the more thin, lower portion in the pelvic well, I would probably only start with taking 3 air cells out at a time, and really making sure that you're not taking too many out. And then, like I said, make sure you're keeping track on that form so that you can put them back in whenever you want, and highly, highly suggest buying that extra, bag of 50 air cells so that you can just take a deflated one out, or you can add without having to subtract from somewhere else. The other big thing that I get a lot is, this cushion feels pokey. And the way to be successful with this is explain to the person before they use it how it's going to feel. Because the worst thing is that you don't know what to expect. You sit on something and you're like, oh, that's so different, because it is. This is new technology to a lot of people, and this is going to feel different from what they're used to on the market. So it has, its own smart cells. They are individualized. So, and they do shift and move with you. So at some point it may feel pokey. So I always say, in order to be successful, and is be honest with someone and tell them what to expect. So I always tell the individual before I put them on it, look, this is a very different technology. Sometimes when you first sit on it, it might feel a little pokey, but we need to give you time to settle into the cushion. And after probably 3 to 5 minutes of being on the cushion, you're going to realize that it doesn't feel pokey any longer. Those air cells will settle onto you under your weight, and that will go away. And then if it doesn't, then I can actually take some of those air cells out, and we can play with the cushion so that you don't feel that pokiness any longer. So again, then you can take them off of it, take a couple air cells out at a time, and then put them back on it. But that pokey feeling will go away. And again, the more upfront you are with somebody, the more they're going to be successful with wanting to use this cushion. Another great thing is this question right here is that the adjuster O2 and the active O2 do come in low profile. So it comes in more of a 2-inch height versus maybe a little over 2-inch height. But they still do meet the ISO standard for skin protection and have sufficient immersion to still be considered a skin protection product. So whether you go with the full height or the lower profile, you're still protecting someone. Another big cushion I get is, why is the active O2 cover different? Because the adjuster O2 and the VicairO2, it has that perforated liner and all the air cells go right into it. Because this one has a foam inlay, it has a cover, and then each of the compartments is within its own perforated liner. And then the foam obviously is not a perforated liner, it's more of an incontinence liner so that nothing can get into that foam. And again, it gives you ability to take the foam out so that you can wash the rest of the cushion. But this is the actual cushion cover. Another big question I get is, can I put glideware? I know a lot of you out there know of our glideware that goes on our foam products, and it's absolutely not needed on air technology. We've done studies with this through the University of Pittsburgh, and foam products inherently cause the skin and the tissue to stick to it. It's great in one sense because it's very stable and it won't allow someone to slide off the cushion quite as much, but it also causes skin and tissue to stick when a pelvis goes into movement. So what the glideware does is that we strategically place glideware on foam cushions so that the skin and the tissue will actually move with the bony landmark. So it will move with the pelvis, right? So that you don't get any tug on the skin and you significantly reduce the risk of shear forces when you're using a foam product. So glideware is fantastic and highly recommended on foam. But air, if you remember back to those 2 videos that I showed you, the air moves with your skin and tissue and with the pelvic movement, not against it. So there's no need for an extra piece on it to help with that. So it is such the actual neoprene from the Rojo and the movement of the air cells and the what they're made of move with the client and their micro movements. So there's no need to have the glideware. And we've done testing on it, and the shear was so reduced in air technology, there was just no need to add glideware at an added expense. All right, so last thing I want to show you, which most people don't even know exists, and I do feel it's necessary since we're talking about Vicair, is the fact that we have heel protectors that are Vicair based. And another thing that I think a lot of people don't realize is that, we're really wrapped up in sacral wounds and ischial wounds and coccygeal wounds, but we don't realize that heel wounds are the second most common and prevalent pressure injury worldwide. And so we have a Vicair product that actually can deal with that. And this is a product that is kind of in a league of its own, honestly. And it is an advanced medical device. It is designed to be used with someone as a preventative measure or with someone who already has an existing pressure injury. And there's many case studies that show how it has really helped to offload that heel to allow that area to heal up quite nicely. And again, the whole reason that it is in a league of its own is because it offers this advanced heel offloading. So I'm going to show you in a picture in a second, but there are air cells here and going up this way on both sides for all of the bony prominences in the foot to kind of immerse into air and be protected by it. So you still get that kind of frictional component that it reduces shear and friction. It also immerses that person's bony prominence to protect that area from breakdown and the skin and the tissue underneath. And you'll see it again in a picture, because it kind of builds somebody up, it completely offloads the heel that is obviously the high risk area for breakdown. The other really cool thing about this is, again, it is completely machine washable. So you can use it with multi-client use again, because once it's washed, it's completely washed and disinfected in case you're in a nursing home setting and they have to be used that way. If not, you want to use it for single use, you can just put the customer's ID or whatever to make sure that it's only going to that person. Another great thing is this non-skid surface on the bottom. Unlike many boots on the market, like the bunny boot, which is made of foam, if you try to stand and walk on that thing, you're going to fall, okay? This has a non-skid bottom. It is not meant to walk 300 feet. It's really meant for someone so they can stand up and transfer from one area to another, 10 feet, with decreasing their risk of falling. So a lot of clients don't have to take it off and can transfer from their wheelchair to the toilet, bed, etc., decreasing the risk of fall. So this is just kind of going over what I just said. Excellent offloading of the heel. You still get that shear and friction protection because of the air cells inside. You can transfer with it on because of that non-skid bottom. Phenomenal for washing and multi-client use, and very easy to don and off, which is just a snooty way of saying easy to put it on and take it off. All right, so this is how it works. This is the picture that I wanted to show you. This is kind of showing what we see from the outside, and you can actually see the silhouette of the foot on the inside, and then you actually see what's going on the inside. So here are those air cells that I was talking about that will sink the heel and the foot into, and you can see that the heel is completely untouched. And a lot of times we'll stack up a patient's heels on pillows, if we don't have some type of heel protector. But what happens is gravity or whatever movement, they just slide off those pillows and they slam the heel down to the bed. And that's not great. The other thing is, a lot of the other ones on the market, you still are wrapping around the heel, but something's still making contact with the heel, the foam, whatever it's made of. This boot is truly an advanced offloading of the heel so that nothing is touching the heel when you're wearing the boot. And what you're seeing here is just the cover, but you can see that the heel is still completely offloaded. And again, fantastic. I just kind of put how, what are the degrees, both Celsius and Fahrenheit, of how you can wash this product. I wear this, I don't wear this, but I put this on patients that can, that are in bed. And I also use it a lot of times with people that are in a wheelchair that have very bad contractures, that I can't get into a shoe and I can't protect them from a shoe, or etc. Or I'm afraid that they're going to break down against the foot plate. And so they can wear this while they're in the chair. And a lot of the patients that have used this in the chair actually talk about how comfortable it is. So can be used in the wheelchair or lying down. In the US, we only offer the standard size, hoping that changes one day. In Europe, they do have 3 sizes. But if you want to see if this will work, you can measure them this way and see if that's going to fit. And then this is just a quick direction of just how easy it is to put on. You slide the foot so that the heel goes all the way into the offloading piece. You put the flaps across the top of the foot first. Then you put the flaps over the calf portion, and voila, it's on. And then you do a quick little finger check underneath to make sure that that heel is completely offloaded. And that wraps up our webinar for today. So I'm going to open it up for questions.
All right. Thank you, Anna. Just give me a second. We do have some questions that came in, and we'll have time for a few. Do you have an answer? How is the number of cells predetermined in the cushions?
So the cells are predetermined. They've all done studies with all of these, obviously in where they come from, in Denmark. And that's just a formula they came through for years and years of research of deciding how much was going to be in each cushion depending on the size. And then, like I said, you are able to add or subtract according to your patient's or your specific individual need. So, and each cushion is obviously different depending on the size of the cushion. So that's why it's important to understand that all VicairO2s are not going to have the same amount of air cells in each compartment. It depends on the size, because the 20 by 20, the compartments are bigger, obviously because the cushion is bigger, and they're going to have more air cells. So again, that's some engineer that came up with this and been through rigorous testing. So that's beyond my smarts. But yes, each cushion does have a predetermined number of cells depending on its size. So it's very, very important to look at the tag on the back to know what that was.
Perfect.
So I'm sorry, I don't have a smarter answer for you, but that's
no, that's smart. That was smart enough. Thank you. There's a couple of people have asked about traveling with a Vicair cushion, changes in pressure, going in an airplane. Will the air expand the individual cells? So
they will. Then that's what's interesting about the Vicair, is that because it's contained in a much smaller container, it will expand only to a certain amount. So you're not going to get something that becomes rock solid, right? The bigger the container, the more the air can expand. So you are going to get some expansion, because you guys saw with each air cell that it's a soft outer layer. It's made up of a soft material. If that happens and it becomes uncomfortable, you can truly, again, just take some of those air cells out to negate that. But I don't think that you're going to notice that much, especially for being in an airplane for a short amount of time. I don't even think you really notice that much in an airplane. But if you do go to a very high mountain range or something and you start to notice it, you can just negate that increase in pressure by taking some of the air cells out.
Yeah, and
that's
the same. Yeah, that's the same recommendation with the Roho cushions too, is know what you feel and modify the air if you need to, whether you're in the airplane or up in the mountains or whatever. So thank you for that. So the cushion's washable, which is great. How should it be dried, especially for are the inside of the cells going to get wet, and how do we ensure that they're dry?
So the inside of the air cell will not get wet. Once you touch those air cells, you'll see it's not Permobil, it's water. And we suggest that you air dry them. They would air dry very quickly. Again, once you start to touch this material, you'll realize that it's not going to get saturated on the inside. So very quick, air dry. The air cells on the inside will not get saturated inside of the air cell, and very quick to dry.
Perfect. And Permobil in the United States offers the Vicair cushions that you described. Are there any one question came about the standard active O2 rather than the low model. We don't offer that, and we won't be changing what we're offering anytime in the future.
So the active O2 does
Yeah.
come in low profile and high profile. The adjuster O2 also comes in low profile and high profile. The vector O2 does not come in low profile.
Okay, so we do offer it. Perfect. That is great. One last question. What are, or do you know the warranties of these cushions offhand?
I don't want to misquote it, but I honestly, I thought it was a lifetime warranty, but I could be wrong. Do not quote me. That is something that we will have to
The
check
information
out.
is on our website though, right?
Yeah, it is on our website. But again, one thing I just want to reiterate with this cushion, which makes it so great, is that unless you go and rip the cushion open, if an air cell were to go flat, number one or two air cells you will never notice. You will never see that. And you will never feel that because it's strength in numbers, right? If you do for some reason have a ton go, which is very odd, but if you do have a ton to go flat, then all you have to do is replace them. So it's not ever really needing to actually replace the whole cushion. And the air cells themselves, we ask you to purchase an extra bag so that you can replace air cells as they go flat, because they will go flat eventually over time, right? So that part is, we're not going to replace a cushion because one or two air cells went flat. We just would ask you to replace those with an extra bag.
Awesome. I'm going to ask you one last quick question. And for anyone who's asked a question that we haven't gotten to, we will get back to you via email. Anna, are the Vicair cushions latex free?
That's a great question. I'm not sure off the top of my head.
Okay, so we'll find out. Sorry for asking you a question that you didn't know the answer to. I apologize. Our next webinar is in a couple of weeks, so we've got a few fast and furious webinars this month. Our next webinar, we have something very exciting to tell you about, a new product announcement in regards to our smart drive. It will be on June 7th, 1:30 Central Time, so please look for the registration information and join us there. Anna, thank you for this. Fantastic information, so clear and concise. We will get to everyone, and like I said, we will get to everyone's questions that we didn't get to live. So thank you so much, Anna, for presenting today.
Thank you, guys. Have a great day.
Thanks, everyone. Have a great day, and we hope to see you all soon.